Elinor is a chair of the Northwest Board for Remember Srebrenica, remembering the genocide in Bosnia, and she's also a trustee of the British Muslim Heritage Centre.
Thank you. I'd like to ask about the vaccination. You know, I was really delighted this morning to be watching the news, and they were showing a 90-year-old woman, the first person to receive the Pfizer vaccine. I'm asking really what the rollout plan is for Greater Manchester and what we as a community can do to help.
Thanks, Eleanor. Really good to see you. So it started today. We've also vaccinated the first patients in Greater Manchester. The two sites that have kind of been the first recipients of the vaccine are Salford and Stockport. Salford Royal and Stepping Hill. But they will be coordinated. They're just going to hold the stocks, but they will be going to other hospitals as well. So NHS staff are the first priority as part of the rollout. So that's going to be done in the first instance. There is a challenge about this vaccine and kind of promoting its use more widely in the community, because you've probably heard in the media about the storage requirements make it complicated. Yeah. However, that said, there will be a mass vaccination centre at the Etihad, and then in every locality there'll be a designated primary care centre, and those locations, I think there's 60 something of them across Greater Manchester. So what people say, Eleanor, is that it may well be the Oxford vaccine that really starts the rollout proper. You know, the Pfizer vaccine is obviously, we have less plentiful supplies of that one, and it has those complications with regard to rollout. But that said, I mean, it will be health service staff, and then obviously the priority groups, and particularly care home residents. But I think it'll be the Oxford vaccine, which I think is also subject to some good news today. I think it's been declared, I think there's certainly some trial data that's come back today that says it's both safe and effective. So it seems that one is not a million miles away. I think when that one is being rolled out, that is when the widespread community rollout is said to be going to be, taking full effect, and that'll be probably in the early part of next year. I think we need to really use whatever avenue we can to build trust and provide information and give people confidence, really. I think that we mustn't repeat the mistakes of the test and trace system, which didn't do enough to kind of put information into different languages. And, that was a simple thing that should have been done that wasn't done. I think that reflects the problems of running these things nationally rather than in a more locally determined way. So that was, one of the learning points that we went through, particularly when Leicester was the first place to see the spike in cases. So there is definitely going to be things that can be done, and I'd be open to ideas from any community as to how we could, get the messaging right, build the confidence and the trust. So, I think it's coming now, but I think we've got a few weeks still before the wider rollout into all of the priority groups. I think we are still looking at February sort of time for that to, so there is time to influence that.
I think as communities, we can help into helping, for example, with translating messages and disseminating that through, for example, social media and sort of our own community connections and places as well. But also thinking as to whether, work and community centres could act as vaccination centres, using volunteer medical staff from the community to deliver those medications. In that might be seen as a trusted environment with trusted and known personnel delivering them, and as such, maybe the uptake, would be better. That's one of the thoughts that I was having, certainly in our community here in South Manchester, that there are many sort of medical personnel who I'm pretty confident would volunteer to assist in the vaccine rollout programme.
Good suggestion, Eleanor. I don't think the plans for the wider programme that I've mentioned are set in stone by any means yet. I think in the early days they will want to probably control it and be quite careful about, about how we develop it, and that probably will be health staff first and foremost. The suggestion that you've made, I will feed into a discussion we're going to have tomorrow on this very matter with the Greater Manchester COVID Emergency Committee. So I will take your offer, your kind offer, and I will put it into that discussion tomorrow morning.